Hello, friends, and welcome back to Heartscapes, where we explore the system of Reiki at the intersection of our self-reflection, spiritual practices, and taking social action. My name is Michaela, and I'm so glad you're here. A couple of weeks ago, I posted a video in my series on cultivating a trauma-informed Reiki practice. And this video sparked a lot of really valuable dialogue within the Reiki communities I'm a part of, a number of comments and questions coming forward that I wanted to explore a little bit further in this follow-up. So that original video was called Reiki Can Cause No Harm? I'll link it down below. And it invited Reiki practitioners and clients to explore the power of language, to explore the ways that certain forms of language can cause unintentional harm, can unintentionally alienate others. I focus on a phrase commonly used within Reiki communities, Reiki can cause no harm, and discuss the fact that this phrase can be a little bit problematic when we're not careful with how we're using our language. So for example, the word Reiki can be used to describe a phenomenon in the world, energy, that is life force energy, however, various ways we want to describe it. And as a phenomenon in the world, Reiki can cause no harm. However, we often also use that word Reiki interchangeably to refer to the system of practice of Reiki. That is a system enacted by people on and for other people often. And in any system of practice enacted by people, harm can be caused. And that if we're not careful with how we're using the word and specific about how we're applying it, particularly when responding to someone who has reported an uncomfortable or difficult experience that they've had during a Reiki session, then we might unintentionally imply that they are that they should disregard that experience. We might be using that language to disregard and alienate the report that a person is giving about harm that they experienced that might actually have to do with the practitioner's behavior, not Reiki as an energy in the world. So lots of questions and comments came from this video. And one of them in particular, I thought was really a valuable one to explore. It came from another colleague that was looking at the difference and asking about the difference between the sometimes necessary discomfort that arises throughout a healing or transformation process and unnecessary harm. What's the difference between those two things, and how can we support one without causing the other? I just really appreciated this question because it's such an important distinction to make. And I wanted to explore that here. As always, your experiences, your stories, your comments are really valuable for continuing this conversation. And I really welcome you to share them in the comments below, even if, or perhaps especially if they are different from mine or in some way, maybe even contradictory to mine. So the question that he asked is really, having to do with the fact that sometimes, or perhaps even often, the process of growing or healing or transforming physically, emotionally, mentally, spiritually, requires moving through some degree of discomfort or pain. Many of us could come up with examples from our own experience about this being true. For example, when I was 14, I underwent a necessary surgery to remove a large cyst from my liver that had been causing me chronic illness for quite some time. And in the weeks following that surgery, I went through tremendous pain and discomfort. However, I was very aware that this pain was the pain of my body going through the necessary and good work of healing, and that chronic illness I had experienced for so long was no longer there. Similarly, in the emotional realm, when my long-term relationship ended 2 years ago, right in the midst of 2020 pandemic chaos, I had to move through tremendous pain and discomfort. Now, some of that was the pain of my own disordered thinking, attaching myself to, clinging on to something that I had become attached to that was really just no longer there. It was a form of illness of my mind, clinging on to the past rather than moving into the discomfort of the liminal space in between what I once was in that relationship and what I will become. When I finally did surrender to that process, to that liminal space, I experienced tremendous discomfort as I changed and grew and confronted parts of myself that I didn't necessarily want to confront. But just like my post-surgery pain, this was my heart and my mind and my spirit doing the good and necessary work of healing and of growing. The concept of liminal space is one that is really important when we talk about the necessary discomfort of growth, of change, and of healing. So in anthropology, where this phrase originally it was coined, liminality refers to the space within a ritual, particularly a ritual of transition, such as a rite of passage or conferring a new social title upon somebody. It's this space in between when the person is no longer what they once were. They've transitioned out of the role that they've held for possibly their whole life, but they're not yet what they will become. They have not yet taken on that new role. It's this in-between space, this kind of gooey place where we're standing upon a threshold, but have not yet walked through the door. We can extend this concept to experiences in our lives outside of formal ritual when we are facing a transition. Times when we, for example, face the loss of a loved one or a relationship, and we have to learn how to live our lives without them. Times when our role in society is changing, such as when we have retired or taken on a new job, or that time just after our kids move out of the house for the first time. It's this, again, this place where our role in society and in our family and in ourselves has changed, and we don't yet know ourselves on the other side. Liminal space can also open up for us when our belief systems are challenged and we find ourselves needing to let go of long-held beliefs, long-held ways of relating to the world. In this case, liminal space is this gooey, chaotic zone when we realize we can no longer rely on our former belief systems, but we have not yet formed new ones to help us understand and relate to the world, understand ourselves in relation to that which is around us. In her book, The Art of Holding Space by Heather Plett, Heather describes liminal space in this way. It's, quote, a period in which something, a social hierarchy, a culture, a belief, tradition, identity, etc., has been dissolved, and the new thing has not yet emerged to take its place. It's that period of uncertainty, ambiguity, restlessness, fear, discomfort, and anguish. It's the space in between, when a trapeze artist lets go of one bar and does not yet know if they will be able to catch the other bar. End quote. The strange thing is that even the joyful transitions in our life ask us to walk through the discomfort of liminality. Think about it. Think about a time when something really amazing has happened, like moving to a new place that you're really excited about, or taking on a new job that is perhaps your dream job, but is requiring very different things of you. Having a child or entering a new relationship, deciding to go on a long journey. All of these things can have tremendous joy and excitement, but also are asking new things of us. They're asking us to do something we've not yet done, and maybe we're not quite certain how we're going to be inside of that space. And therefore, we step inside of liminal space. And oftentimes, and this is so normal, this is so natural, this is a place to hold ourselves in so much compassion for our humanness. Oftentimes our impulse is to rush through this difficult in-between time. We're wishing to get to the other side of that transformation when we've already arrived at our new identity, our new role, when we've settled into it and we understand ourselves and our landscape. We want to step through that threshold of healing and change and transformation, perhaps before we've made the long journey through the dark woods to reach ourselves there. And this is understandable. Again, something to hold ourselves in compassion around, because we live in a vulnerable body and in a difficult world. We naturally avoid pain and uncertainty. It's part of how we've survived for so long. Often we choose the familiar pain of remaining stuck in that which we have already known, right? Have you ever experienced that, or perhaps witnessed somebody doing this? We choose to stay stuck in the familiar pain rather than stepping into the unfamiliar and vastly more frightening pain of letting go of what we have always known. And honestly, our modern Western culture just really does not support us in this space well, as focused as we are on product over process, on, continuous upgrades, on efficiency. There's nothing efficient about liminal space. No, it's far more beautiful and far more terrible than that. In another video that I released earlier this week as part of my series on Reiki and poetry, I share a story poem that Heather Plett includes in her book that uses a really lovely metaphor and a sweet little story to explain the experience of liminal space. If you want to explore that a little bit more in a novel and creative way, I'll link that video at the end of this one. So the point here, though, is that traversing liminal space is necessary in order to complete a thorough and a really nourishing and thorough experience of healing and transformation. We just really can't avoid it. And if we choose to stay out of liminal space, then that change, that healing just waits. It just doesn't occur, or it occurs in an incomplete fashion and has to be repeated in some future time. And because this is difficult, we need practices and structures such as ritual, and we need loving support. We need community in order to tolerate the discomfort of navigating this space. And that's where a practice like Reiki come in, and other embodiment practices. Whether we apply Reiki as a self-practice, as part of our own self-care, or whether we turn to a practitioner for Reiki sessions, Reiki can really be a balm, a soothing medicine for that discomfort. On the other hand, Reiki can also, be a catalyst to, spark the change, to bring it more front of mind for us, creating a space of trust and safety where our system, our body, mind, heart, and spirit can take up that healing response, take up that journey, and that possibly the discomfort that comes with it. And therefore, as Reiki practitioners, we're often taught to share with our clients this possibility that there could be some discomfort that comes up mentally, physically, emotionally during a session, and that it's not necessarily realistic to expect that Reiki sessions will always be relaxing and comforting, even though they often are. And here, it's right here that we get to take a really good look at my colleague's question about the difference between necessary discomfort and unnecessary harm. Because make no mistake, unnecessary harm can and does happen inside of Reiki sessions. I know this because I have witnessed it, I have experienced it, and I have caused harm inside of Reiki sessions out of carelessness, out of naivete, arrogance sometimes. In that original video that I referenced, I share a story about a time very early in my Reiki training when I caused unnecessary harm to a client out of my own carelessness inside of a session and just not knowing better around a particular thing. So, what is the difference between necessary harm and unnecessary discomfort? Well, for that, we'll turn to another concept that will help, that of the window of tolerance. And then that will bring us to just taking a short look at the core elements of a trauma-informed Reiki practice. So the concept of the window of tolerance was developed by Dr. Dan Siegel, who's one of the foremost researchers on the physiology of trauma and the healing of trauma. And the window of tolerance is defined by the National Institute for the Clinical Application of Behavioral Medicine as follows. The window of tolerance describes the optimal zone of arousal for a person to function in everyday life. When a person is operating within this zone or window, they can effectively manage and cope with their emotions. In other words, when we're inside of our window of tolerance, our thoughts and our feelings are integrated, they're aligned with each other, and we're able to think and feel at the same time. Our rational mind is able to interpret what we're feeling and make good decisions about how to respond. It is from inside of the window of tolerance that we're able to navigate the messiness of liminal space. But when an experience triggers our fear response or a stress response or even a traumatic response inside of us, our rational mind kind of gets pushed out of the way. The reactionary part of our mind that governs our fight, flight, freeze, and appease response takes over our rational decision-making abilities. We can think about the window of tolerance as this like centered space and, where we feel, more or less okay. It doesn't mean that we're not stressed or not experiencing discomfort. Certainly we do, but we're able to tolerate it. We're able to continue functioning. Our rational mind is able to continue working, and the healing response inside of our body is able to proceed. We're able to learn and grow and change from within our window of tolerance. And that range is different for all of us, narrower or wider based on our experiences, perhaps our age, our emotional maturity, whether or not we've integrated past traumatic events. If we're pushed above the line of our window of tolerance, then we can become hyper aroused, which can express itself in responses like restlessness, inability to relax, hypervigilance. Physiologically, it can cause like digestive issues and high blood pressure, even things like explosive anger or panic attacks. Conversely, if we're pushed below our window of tolerance, we can go into hypoarousal. And responses there can include lethargy or depression, a sense of disconnection from ourselves and from others, from our life, dissociation, where our awareness actually leaves the body and we're not really super aware of what's actually happening to us, a sense of disconnection from people, from life, and physiological responses like excessive fatigue, disorientation, low blood pressure, and even unexplained pain in the body. Now, it's really possible, common really, to be able to increase our window of tolerance, to be able to expand the amount of discomfort we're able to be with and be inside of while still remaining more or less okay and grounded and able to think. In fact, that's, one of the things that really, really kind of defines like growth and maturity, right? From our infant state where we're able to tolerate very little discomfort at all, to a more mature state where we can really take an assessment of what's happening, assess the risks and make good decisions inside of that. And this is where, various forms of, embodiment practices like Reiki, like yoga, like martial arts, like meditation can really be supportive, to help us to expand that window of tolerance. Because the thing is that growth and learning and healing occur when we are inside of our window. In particular, when we're pushing ourselves up against the edge of our window of tolerance, we're expanding and growing and stretching kind of in that uncomfortable place, but not passing over that line, not stepping outside of our window of tolerance. This is one of the reasons, again, that embodiment work has become so important to the process of healing trauma, to formal trauma therapy processes, because it can bring us back into relationship with our bodies and with our body's strength and resilience with our capacity. But, and this is a big but, such practices can also include experiences that push us outside of our window of tolerance. When we are pushed too far or too fast, or we're not given choice or the ability to make decisions about what we're experiencing, either because of our own volition or the actions of a practitioner or something else outside of our control. And once we've moved outside of our window of tolerance, outside of our ability to integrate what we're thinking and feeling, so that our fear and trauma response takes over, well, we're no longer able to heal, to grow, to learn in that moment until we come back inside of our window. And this is important. I really want to emphasize it. When we move outside of or are pushed outside of our window or window of tolerance, healing and growth and learning stop, right? Whether that is, in the midst of, some life's challenge, or whether it's on a Reiki table. If we're in a healing process and we get pushed outside of our window of tolerance, that healing process stops until we come back in, because our system is hunkering down into pure survival mode. And that's all that matters in that moment. And this is the point where necessary discomfort shifts into unnecessary harm. As Reiki practitioners, we cannot always know where a person is. We cannot always control what a client is experiencing, or whether they have been pushed up to the edge or beyond their window of tolerance. But there are mindsets and protocols that we can put into place, that we can use consistently inside of our practices, to reduce the chances that our actions might push a client outside of their window of tolerance. There are also things that we can do to help our clients come back into equilibrium, to come back inside of their window of tolerance if they have been pushed outside of it. These mindsets and protocols add up to a trauma-informed Reiki practice. They create a container of safety and trust, of choice, of consent and control for our clients. Now, there are many things that can trigger a person and push them outside of their window of tolerance. And it's just endless. It's so individual, right? Because it's based on a person's experience. However, I want to just focus on 3 examples of mistakes that we as practitioners can sometimes make that can lead to these outcomes. And these are things that all of which I've either witnessed or myself enacted as a mistake inside of Reiki practices. So one is, a range of ways in which we might be careless inside of our Reiki session. So this can look like failing to inform a client about something that they might experience inside of a session. For example, placing an eye pillow, like a weighted pillow on a person's eyes without telling them. That can be very startling and frightening to have the sight cut off without notice. It can look like sinking so deeply into our own practice inside of a session that we fail to notice and kind of stay connected with our client. We fail to notice that they're becoming distressed, and just kind of proceed without addressing that. It can look like being careless with our hand positions and accidentally touching somebody in a no-touch zone. Secondly, another example is offering unasked for diagnosis or assessment. This one is a little tricky because oftentimes, part of what we, feel called to do and what we might be expected to do inside of a Reiki session is to, assess or diagnose what's going on with a person, to share our insights about what we noticed during the session or what we know about the things that they're reporting to us. However, if we do that without consent and without being asked, then in a way, we're taking away that person's agency. We're taking away their ability to be in control of what they understand about their experience, to make their own meaning of their experience. And we might share information with them that they might find frightening or alarming, disquieting in some way, or that might feel invasive. And this can be an experience that triggers someone to move outside of their window of tolerance. And lastly, this kind of more general category of assuming that we know what's best for another person's healing. If we assume, for example, that all discomfort is good and necessary, and that because Reiki can cause no harm, that anything that happens inside of a Reiki session must be for the healing and greatest good of the person, then we might push them or encourage them to stay inside of a discomforting experience beyond what they're actually able to tolerate. We might take away their ability to choose how much discomfort they want and are able to deal with in a given moment. If we assume that we know best what they can and should tolerate, then we're taking away their choice. We're taking away their right to consent to what they are and are not willing to experience. And this erodes safety and trust, making healing difficult or impossible. Now, all of these mistakes and many others can be reduced or eliminated by, shifts in our mindset and our protocols. Um, Taking care with each client to put in our practice opportunities to open up choice, consent, and control. How we get there is the focus of my work on cultivating a trauma-informed Reiki practice. And if you're interested in learning more, I'll put a link to more information down below in the comments. Now, so much of the distinction between the sometimes necessary discomfort of healing and unnecessary harm brought on by our actions comes down to how much choice we have afforded our clients and how much they're able to control their own experience. And this is where the beautiful flexibility of Reiki as a practice really serves us so well. It's one of the reasons I absolutely love Reiki as a practice and choose it over others to work with other people. Because virtually anything that happens inside of a Reiki session, from the client's body position to the sensory elements in the room to whether or not they even experience physical touch at all, is flexible. And in any of those realms, there are many modifications that can be offered that can put choice and control into their hands. Again, generating the necessary trust for healing to occur. So, to the Reiki practitioners watching this, I invite you to get creative and curious about the structures of your sessions, to look for places where you can offer choice. For the Reiki clients watching, I want you to know beyond any doubt that you are worthy of choice and of control over your own experience, that you are the expert of your experience. Your system, your body, your mind, your heart, your spirit knows exactly what is needed for your healing in any given moment. And you can trust your intuition to lead you and to tell you what is or is not supportive for you in a given moment. You deserve practitioners who honor this for you. Yeah. So I hope that these perspectives have been helpful. I hope they've offered perhaps some new questions, some new ways of thinking about your experiences as you navigate your experiences with Reiki as a practitioner or as a client. If you want to investigate more questions related to these topics, I do have a playlist on cultivating a trauma-informed Reiki practice, and you can learn more about that practice in the link below in the comments in the show notes. Wherever you choose to take this inquiry, wherever you move throughout your day after you leave this video, I hope that you are deeply provisioned for that journey, that you are nourished and supported and aware of your own capacity and your own resilience. Thank you so much for taking these few steps with me today. I look forward to being with you in another video. And until then, I love you. Have a great day.